How to support residents with their daily mouth care. Always provide mouth care in a way that addresses their needs, whilst offering them respect, dignity and privacy. This section provides information that will help care staff plan and deliver effective mouth care for each resident. Infection prevention and control. All staff should undergo training in infection prevention and control and are expected to follow their local infection prevention and control policy based on national guidance. This will include hand hygiene, cleaning of equipment and use and management of personal protective equipment, such as disposable gloves, fluid-resistant surgical masks, eye protection and aprons. Be prepared. Get everything you need before you start. Ensure water being used is drinking water. Each resident should have a named toothbrush or a named brush for cleaning their dentures. Rinsing of toothbrushes with water must be thorough, but they should not be soaked in disinfectant. They should be stored upright in the individual ventilated holder, ideally inside a clean, dry cupboard, allowing them to air dry. Denture containers should be named and must be emptied, washed, rinsed, dried and stored dry when not in use. Residents who carry out their own oral care should be encouraged or helped to ensure that oral health equipment is kept clean. Mouth care for people with COVID-19. When providing mouth care, wear personal protective equipment to prevent contact and droplet transmission. Please refer to your local guidance on infection prevention and control. People with COVID-19 are more likely to cough when performing mouth care. Be gentle, stand to the side or behind them, take breaks to allow the resident to rest and swallow. If possible, sit the person upright. Do not use an electric toothbrush as this may cause droplets and splash. If the mouth is dry, encourage sips of fluid and use a dry mouth product. If a person is confused, refuses or resists care, stop and try again later. Mouth care is an important part of the overall care provided. Please refer to the toolkit for more information and links to resources. If a resident is independent and can undertake their own mouth care, ensure they have access to a sink and a mirror. Check they have the suitable products. Check the person is mobile and able to access the bathroom. You can still reinforce the importance of cleaning their teeth and give any advice about the best way to do this. Some residents will need some support with their mouth care. Prompt, encourage and support the person to manage their own mouth care as much as possible. Carry out the task in a quiet, distraction-free environment with sufficient light and where the resident is most comfortable. Ensure the resident's privacy and dignity are maintained. You may consider demonstrating with a toothbrush or showing pictures of someone cleaning their teeth. They may just need help to put toothpaste on their brush or to get the items ready. Constantly check the person is all right and reassure them. Use the best time of day for that person. First thing in the morning can be a busy time, and you may get a better clean later in the morning. Keep a record of what works and add it to the care plan. Using the right tools and techniques will ensure mouth care is delivered in a way that maximises the benefit to the individual's oral health. Some residents may find it hard to hold a toothbrush handle. Just like cutlery, a toothbrush can be adapted with foam or piping to make it easier to hold. If the resident has one and can tolerate it, an electric toothbrush cleans teeth very effectively and can be easier to hold. It also makes it easier for a carer to clean somebody else's mouth. If these methods do not work, then consider using a specialist toothbrush, which cleans all 3 tooth surfaces at once. Please look at the resources section in the toolkit for more information on products. For someone who needs help, check the oral care plan before you begin. As a general rule, try not to wake up someone to clean their teeth, as they may be more disorientated and less able to cooperate. Explain that you are going to clean their teeth, using appropriate language. Stand in a position that is comfortable for you both. It will be easier if the resident sits and you stand beside or behind them. But remember to try not to approach someone with dementia from behind without warning. Ensure the person's head is supported. A high-back chair can be used, or pillows if they are in bed. Check they are comfortable, and agree a stop signal in case they feel they need to take a break. Check if there is anything they are concerned about, and check the mouth before you start for ulcers or areas that may be sensitive or sore. Be gentle and careful where you place your fingers. Continually check the person is comfortable and give rests, as keeping your mouth open can be very tiring. Cleaning a mouth that has dentures. Dentures improve the ability to chew food, help with facial appearance and aid speech. Unless there is some reason for not doing so, then encourage the resident to wear their dentures and help them put them in if they cannot do it by themselves. Dentures should be removed at night to reduce the risk of mouth infections. Dentures should be worn daily, particularly those worn with existing teeth. If left out, existing teeth may move slightly into the gaps and the partial denture will no longer fit. However, for acutely ill residents, they may be unable to wear their dentures. In this case, store in a dry, named denture pot when out of the mouth. But it is not recommended to leave dentures out for long periods because the gums can change shape, meaning the dentures won't then fit. A dentist can reline badly fitting dentures and will do this if they feel it is appropriate. But this may only provide a temporary solution. There may come a time when it is in the best interests of a resident to stop using their dentures. This may be because the resident can no longer tolerate them or the dentures no longer fit. This issue may need to be handled sensitively, and the outcome should always be in line with the dentist's or a doctor's instructions. As people get older, it can be difficult to make dentures that fit. So it is important that existing dentures are not lost. Adjusting to new dentures can also be very difficult for some older people, particularly those with dementia. Care for dentures. It is just as important to clean dentures as it is to clean natural teeth. Debris can build up on dentures and if not cleaned regularly can cause denture-related infection, such as stomatitis or thrush. Other equipment, such as denture pots, also need to be kept clean. Remove any partial or full dentures. Be careful, especially if there are any metal parts, as these can bend. Look out for red or sore areas caused by the dentures, and update the care plan if needed. Remember the mouth and any remaining teeth will still need cleaning, even if the person wears a full denture. And dentures should be removed before any natural teeth are brushed. Please see the toolkit where there are useful links to videos and resources to help with removing and inserting dentures and cleaning them. Cleaning dentures. Dentures should be rinsed after meals and cleaned once a day. Dentures are expensive and can be fragile, so to avoid breaking them if they are dropped, clean them over a sink or bowl filled with water, or over a folded towel. Brush all the surfaces to remove debris, paying particular attention to the fitting surfaces, using a non-abrasive denture cream or unperfumed liquid soap, but ideally not toothpaste. Soak dentures every day in a denture cleaning solution. This will help to remove any plaque and stubborn stains. It will also help to disinfect the dentures. Always follow the manufacturer's instructions on the packaging, but don't leave in the solution overnight, as most denture cleaners only take 20 to 30 minutes to complete the clean. Rinse the denture and store in a dry named denture pot. Denture cleaner is a harsh chemical, so do not put dentures with denture cleaner in a glass, as they may be a risk to the resident, as they may drink them by mistake. Some residents may use denture adhesives, especially if they have badly fitting dentures. Adhesives come in different forms, paste, powder or strips, and they are used to hold the dentures in place. Follow the instructions and ensure that the correct amount is used. It is often the case that too much is applied, and this can be an aspiration risk. After removal of the dentures, ensure all traces of the adhesive are cleaned from the resident's mouth and from the denture. Dentures should be named to avoid loss, as it provides easy recognition of the resident's dentures. If dentures do not already have any identification, they should be marked with the resident's name. If using a commercial do-it-yourself kit, please follow the manufacturer's instructions. Cleaning someone else's teeth. Gently move the lips and cheek so you can see where to put the brush. Try to start in the same part of the mouth each time and clean every tooth in order. This will make sure you do not miss any parts of the mouth. Angle the toothbrush towards the gums and include the part where the tooth meets the gum. Brush the outside, inside and biting surfaces of the teeth in a methodical way. It should take about 2 minutes. Include cleaning the tongue. Be aware of any loose teeth and brush with care. If gums bleed, do not stop brushing. Continue to brush gently but thoroughly to clean the area. Encourage the resident to spit out after brushing, but ideally not to rinse out. Keep a record of any changes you see. Carrying out mouth care at the same time every day may help, especially if the person has dementia. Please see the toolkit where there are useful links to videos and resources to help when cleaning someone else's teeth. In summary, promote independence, encourage and support the individual to perform their own mouth care. Remember to always consider the person's comfort, privacy and dignity when you deliver mouth care. Be prepared with everything ready before you start, and always explain to the resident what you are doing. Work with the resident and review their needs to adapt their mouth care to get the most effective clean. Perhaps consider cleaning the mouth in smaller sections more frequently through the day. And remember to record what care has been provided and refer to a dentist if you are concerned about anything you find in the mouth.